One of the challenges we have in pregnancy care is stillbirths, and unfortunately that happens in about 1 in 400 pregnancies and would affect in Ireland about 125 families per year. And obviously this is devastating for a woman, her partner and her family. But it's often difficult for us to identify which babies are at risk of stillbirth. And therefore this is a problem that we are constantly trying to work to reduce the rate of stillbirth and to better monitor pregnancies that might be at risk of stillbirth. We do have good pregnancy outcomes for mum and baby, but there's always room for improvement, and there are many areas that we feel we could improve upon. So therefore, by looking at these cases and examining the underlying causes and coming up with solutions and interventions, that helps us improve outcome for mothers and babies.
The FeMo study is a research project in which we are developing a monitor for fetal movements. Fetal movements are a really important indicator of fetal health, of how the baby is doing, but we have no way to measure them outside of the hospital. We have developed a belt that can measure the movements and track the movements in the woman's home, and we're hoping that in the future that belt could be worn in pregnancy to monitor the movements, to keep an eye on the movements and potentially prevent stillbirth. We have completed our first clinical study, which means research study on pregnant women of our device. We recruited 40 women in the National Maternity Hospital, and the study went very well. We got amazing data from the monitor for both daytime and nighttime movements of the baby. We're very grateful to the participants who generously gave of their time for our research. Ultimately, the benefit that we believe our device will bring to pregnant women is to prevent stillbirth. It's only with funding that we can do the research that can really make that difference for patients. For example, the Fetal Movement Monitor, the idea for that, we had the idea maybe 12, 13 years ago. It was only in the last 2 years, when we received substantial funding from a not-for-profit organisation, that we were able to make the idea a tangible reality and have it to a quality and safety standard that it was suitable for trialling in our participants here in the National Maternity Hospital. If I could say one thing to the supporters of the NMH Foundation, it would be that the money donated through the foundation can make a huge difference to the women and the babies of the future through the research that we do today.